Welcome and thanks for joining us. My guest today is Doba Parushev, a managing partner at HealthWorks for CareFirst BlueCross BlueShield. So what is HealthWorks and how does it fit into the broader CareFirst strategy? Can you explain it to people who've never heard of it in a way that's simple to understand for everybody?
Absolutely, Nick, and thank you so much for having me today.
Thank you.
So I suspect that many of your listeners have heard of us, but just in case, CareFirst BlueCross BlueShield is a health plan that primarily serves the Maryland, DC, and Northern Virginia areas. So we have about 3 million members, and it's our privilege to serve them. Also, I suspect many of them are WTOP listeners, so I hope they're tuning in today.
Yeah.
As you can imagine, as a nonprofit health plan, our mission is to provide affordable, accessible, equitable, and quality healthcare for all the people that we serve. That's not an easy task. Right? It takes the hard work, the determination, diligence, and drive from our own team, but also humility in recognizing how many and how big the opportunity is in tackling the improvement of healthcare in this country. So with that, we just can't do it on our own. This is why HealthWorks exists. HealthWorks was created to serve as an innovation engine for CareFirst. We solve healthcare challenges by working with others who help us be better, faster, and often more effective than we can be on our own. If you think about it, startups are almost by definition quicker to iterate, more adaptable to the needs of the people they serve, and more creative in answering the challenges that we all face. So that makes them an almost natural fit for what we as HealthWorks and CareFirst are seeking to achieve. So our team creates, partners with, and invests in those startups to bring forward a sustainable solution to make healthcare better for all the people we serve.
Okay, so what is HealthWorks in terms of the part of the organization that you are? Is it a partner with CareFirst? Is it a separate entity? Or can you explain?
Great question.
How does it all fit in?
Absolutely.
Yeah.
So we're very much an integral part of CareFirst, right? Mm-hmm. We work alongside CareFirst leadership, right? We use the resources, expertise, knowledge of all the CareFirst employees that we work together with, right? So if you think about it, it's our kind of more friendly name, right, outside in the business, and we serve as an interpreter between the world of startups and investments and CareFirst as a health plan.
And how does HealthWorks decide what to invest in ultimately?
That's a great question. A big part of our team comes from an investment background. So because of that, we take a pragmatic, data-driven approach to the way we think about investments. There's probably 3 things that we look for at the intersection of which we can do a deal, right? One is, what are the biggest problems in healthcare today? The second one is, what is technically and organizationally possible to achieve? And then finally, what are the business models that are long-term sustainable in what we try to do? So between all those 3 things, typically solutions that we support, fund, partner with, sit at the intersection. To put it simply, we look for practical solutions that bring sustainable change to the biggest problems in healthcare.
And when you look at companies and decide which ones to work with, are there any problems you're looking to solve when you're seeking out companies and trying to determine who you're going to work with, who you're not going to work with? What problems are you looking to solve?
Indeed. In fact, we have our work cut out for us. So I believe in 2022, the US is on track to spend about $4.5 trillion, that's trillion with a T, on healthcare expenditures. And our plan, our members are a microcosm of that. We care deeply about the areas of inefficiency within that spend, where our members are not getting the quality and equitable access that they expect for the dollar that they spend. On one hand, we see opportunities in how care is delivered, finding ways to prevent disease before it occurs in the first place, detecting it and treating it as early as possible if it does occur, and then trying to provide in the best possible way to manage it if it does become chronic. There's also the area of how we engage with the healthcare ecosystem, meeting our members on their own terms, improving the ease and intuitiveness of our own systems, and then finally, making the health journey much more transparent and seamless every step of the way. Those are a couple of areas we care about deeply, and between you and I, there's a lot of opportunity between them.
So you are really involved with startup companies. That's what I'm hearing you say.
We sure are.
Okay.
Yep.
And when you look at startup companies, you want to help them out in many cases. And we know that you have a startup incubator. Could you explain what that is for the people who don't know, including myself, really? That's a term that you don't necessarily associate with startups if you're not associated or familiar with the industry that you're in. So if you could explain what the Startup Incubator is and tell us what it is and why it's so important.
Absolutely. And it's called 1501 Health. Let me start there. So
1501 Health?
Yeah, for our listeners, 1501health.com probably explains it better than I ever could. But with that said, I'll take a quick step back and explain what an incubator is, right? So one thing that we recognize that we see a lot of opportunities for improvement in healthcare. None of us actually knows where the next big thing is going to come from, right? That means that we need to have the ability to work with anyone from large established companies with ready solutions all the way to the two guys in a garage startup, right? That are trying to bring something new to market. 1501 Health as an incubator plays in the latter stage of that spectrum that I described, right? They focus on companies that are earlier in their journey and need some help in getting to market, scaling their solution, fleshing it out a little bit. So it's a partnership that we established between us, CareFirst, as well as one of our local provider partners, LifeBridge Health, where we bring the power of a payer and a provider to work with these smaller companies and give them the tools to navigate, understand, and scale in the healthcare ecosystem.
We've talked with CareFirst BlueCross BlueShield in many of these similar kinds of conversations, and we talk about patients and patient care and that sort of thing. So this is a unique conversation. You're talking about companies and startups and things like that. Can you talk about the unique challenges and opportunities of being a health plan operating in the venture capital area? What are the kinds of things that you experience that are unique to what you do and how it fits into the overall goal and mission?
Absolutely. I think the opportunities is easier almost because it's self-evident, right? And again, I'll use the 1501 Health example, right? One of the opportunities of doing this as a health plan is that we can be very clear about the support, right, that we bring to the table in helping those companies. First and foremost, we bring investment, right? Each of the members of our cohorts of 1501 Health receives $120,000 of investment from us. We bring connections to experts and advisors. We have over 100 executives across LifeBridge and CareFirst that have worked with 1501 Health companies. We use our network of potential partners and customers to give them breadth and scale. And then finally, we create a community of entrepreneurs that can actually help each other through the highs and lows of the journey. So on the opportunity side, we are fairly clear about what we can supply to the companies we work with, but that doesn't mean there aren't challenges. On the challenges, perhaps the core one is rooted in the venture ecosystem, which has historically been split between so-called corporate venture capitalists, that is us, people who represent the corporation, and institutional venture capitalists, who are more individual firms driven purely by a profit motive, right? They need to have a return on their investment. As we look at the similarities and differences between them, we actually do a lot of the same work, but the difference is that we as corporate investors, we target not only financial returns, but also a delivery on our strategy and our mission, which is critical. You will not see us investing in a even very promising automotive company or tobacco company because that would not align with who we are and what we're trying to do.
Right.
So that is probably one of the core challenges in trying to make sure that we work well with everybody else in the ecosystem, and especially in healthcare, that seems to work okay. The institutional investors bring discipline, the ability to keep companies accountable, to help them scale fast, whereas more on the corporate side, we bring more of an industry perspective in alignment with the bigger goals of fixing healthcare.
So we've talked about the opportunities and the things you're looking for in these startup companies. How about success stories? Can you talk about some of the successful partnerships between HealthWorks or that incubator you were talking about, the 1501 Health? The partnerships between you and companies that have received your support and investments, things that you really want to highlight and explain to people what success looks like. What would you say would be some of those examples?
That is a really tough question. So we have a sizable and growing portfolio from across the US. And in fact, in our latest cohort of 1501 Health, we brought in a company from Europe. So with over 20 portfolio companies, picking and choosing is tricky. That being said, I think that because we're sitting here today, I can choose a couple of local ones that might be more familiar to our listeners.
That would be great, yeah.
Let me do that.
Okay.
I'll start kind of north in Baltimore,
Okay.
Where we work with Scene Health. They're a local company that helps us tackle the challenge of medication adherence and support for our members. Their mobile app allows individuals to connect with the care team of pharmacists, nurses, care coaches, and through daily video check-ins to stay on top of their medications. I would say they make it easy, perhaps even fun to do that. And that's a major step in helping addressing medication challenges and empowering them to have a better health journey. If I move slightly further south to Columbia,
Howard County?
Indeed. We work with LifeChair, which is based there. And LifeChair is a solution that is much more feet on the ground. So they help us leverage community gathering spots, churches, barbershops, to engage with our members where our members are, as opposed to having them come to us or points of care and so on. So we believe that by building those trusted relationships on the ground, we actually materially impact the uptake of preventative care, and in fact help people not get sick in the first place, as opposed to having to treat disease.
So you mentioned a couple organizations in Maryland. You mentioned the one in Baltimore and in Columbia and Howard County. If we continue to move south into Washington, D.C., the nation's capital, could you describe some that stand out or one that really stands out in your head that you guys work with?
Oh, absolutely. That is easy. In Washington, D.C., one of our portfolio companies is Socially Determined. Okay. They're an analytics company providing a better understanding of social determinants of health. That is a context around our members' broader life and well-being, and not just how they interact with the healthcare system. We started working with them almost exactly at the onset of the COVID outbreak, and it proved to be very opportune timing in that they were critical in helping us understand where we might have issues of access to food or transportation or housing, and which area may be more vulnerable and stronger impacted by COVID.
Sure.
That allowed us, the state of Maryland, and a number of local organizations to better tailor and target our response to the pandemic towards the people that needed that response the most. So today we work with Socially Determined across our entire organization, over 3 million members, to keep better understanding our members and design solutions that serve them best.
I'd like to thank today's guest, Doba Parushev, a managing partner at HealthWorks for CareFirst BlueCross BlueShield. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search CareFirst.